In this next segment, we're going to be kind of moving on, talking a little bit more about identification of variables, and we are going to look at some commonly used variables so you'd know what worksheets and how to identify certain variables that researchers are usually interested in using. So again, kind of expanding on what we had talked about earlier today, review the common types of research, review worksheets that contain the variables that would collect the information that's commonly used, and then review some helpful resources. So again, some areas of research that are typically used that come from the cost reports include facility characteristics. So adjusting, if you're using claims data and you want to adjust your results based on facility characteristics, researchers often use cost report information to grab that characteristic information. Also, financial health of facilities, net income and loss, your margins, other financial indicators. That's another common use of the cost reports. And then finally, calculating costs or cost to charge ratios. So those are typically what researchers are using the cost reports for. So looking at the facility characteristics, there are some facility characteristics that are used in prospective payment. Things like, let's see, so we need to know the number of discharges, total, Medicare and Medicaid, so that Medicare can determine, well, what proportion of the total belongs to the Medicare beneficiary, so we can, or Medicaid for that matter, to figure out, is this a disproportionate share hospital? So some of those statistics are important in calculating those adjustments. There was a question in the morning about comparing cost report data to AHA data, and this is the article that I was thinking of, the Identifying and Measuring Hospital Characteristics Using SEER Medicare Data and Other Claims-Based Sources. So it was 2002 from Medical Care, and it did look at cost reports and AHA. But what was let me see if I have the summary here. For the article did conclude that the cost report data was optimal for facility characteristics. And I'd have to look back at the article specifically, but I believe that the main point was that the cost report data, the annual submission of the cost report, may have been more accurate. And we'll have to look at the article itself. So here's a list of some of the facility characteristics: number of beds, days, discharges, ownership status, teaching hospitals, uncompensated or charity care, the payer mix, and geographic location, such as urban or rural. And this slide just shows where would you find those types of variables. So mostly it's found on worksheet S3 Part 1, but you can find some of the other variables on S2 or S10. So the S worksheet is the statistical worksheets. That's how I like to think of them. So if you're looking for a statistic, it's likely that's on one of the S worksheets. Here's just an example. It's our same example from worksheet S3, where you can see the items that are collected and the statistical information that's found here. So bed days, beds, inpatient days for Title V, which is a state program, Title 18 Medicare, Title 19 Medicaid, and then all other patients. So you'll see that you can get a picture for the whole hospital. Similarly, for discharges, you can also receive statistics for all patients and then a breakout for Medicare, Medicaid, and another state program. Now, just so that everybody knows that cost report data, that's not the only place where you can get facility characteristics. Let's tell you, make sure you understand all of your options. The provider of services file, we've mentioned this file before, is another source of facility characteristics. It comes from a system called the Online Survey and Certification System. This is coming from another source, so it's coming from when they recertify, and it's a state that manages that process. They The provider of services, what's nice about it, it includes all facilities. So in one file, you'll see all hospitals, all home health, all hospices, regardless of provider, base, facility, freestanding, it doesn't matter. They're all listed in there in one place. The downside is that the collection of the information, it's collected at different points in time. So depending on what the state says they have to, when they have to recertify, that's how often the data are collected. So as an example, the hospitals have to recertify every 3 years. So the data in the POS file could be up to 3 years old. There is a date in there, so you'll know when was it that these data were collected. But just, and again, you don't have to buy one every year if you're only interested in hospitals, but it could change. It just depends on when they have to recertify. So if you were looking at hospitals, you might want to consider cost reports is every year, POS file could be every 3 years. Other facility types, such as skilled nursing facility, home health agencies, they're on a much more regular survey scheduling. So it's every year for those facility types. Hospice, on the other hand, I have never found when they recertify. So that could be really old in the POS file. So you may want to consider cost reports. Other sources for facility characteristics. The Compare databases is a nice place to download information on facility characteristics too. Hospital Compare, Nursing Home Compare, Home Health, and Dialysis, those are all Compare databases that you can easily download and use. I've given some links to current locations of the facility Compare databases and also a link to archived copies. And of course, we've talked about this too, the AHA survey. That will include all hospitals, and I know it has descriptive and financial characteristics in there. Some of the survey information does come from the cost reports. I know the survey is not audited. I mean, they can't. It's a survey, so it's collected. It's whatever the provider is submitting to the AHA. And I haven't looked in a while, but I did at the last time I looked, it was quite pricey. All right, so another area of research that the cost reports may be helpful would be looking at financial health of facilities. So looking at total margins, revenues, expenses, average daily census, bad debt, or charity care. There was a conversation earlier just offline about bad debt and charity care, and the worksheet S10 is where you collect that. There is also, that is suspect, and it is required, but sometimes it's not found there. But it does include the charity care. There is also bad debt that the hospital can write off. That is found within the settlement summary or worksheet E. So that's what Medicare allows a provider to write off as bad debt. So there is that number available to look at as well. Yes?
You mentioned before about confirming, auditing, or checking the data that is reported in the cost report. I realize that because you mentioned about the hospital association, and that data, as you said, is not audited. Right. But what about the worksheet G in the cost report? Is that information verified somehow?
I can speak from experience in the worksheet G because I'm CPA, work with the financial stuff all the time, and it's highly questionable. Yeah. And it's inconsistent from hospital to hospital. And if I've compared it to annual reports and SEC filings and that kind of thing, it's highly questionable. Sometimes it's all you have. And I use it when it's all I have.
And that was the conclusion drawn, or at least that's the conclusion I drew from reading the MedPAC report on sources of financial information on facilities. So you have other options, but that was also noted by Dr. Kane in that document. And that's also in... I read hers and I agreed with the comments that she had. Yes, it was an excellent report. So, and that's also contained within the reference materials that's within this worksheet segment. And again, that will be provided to you so you can download it and take a look at it for yourself. So the locations for the financial variables, most of it, as I mentioned, is on worksheet G. Average daily census, you would find that on worksheet S3. Bad debt, and I noted this before too, is on S10, but there's also bad debt that can be written off. That's also on worksheet E. I wanted to give an example of what worksheet G3 looks like. This is also found in the back of this segment. So this is what you see on worksheet G3, total patient revenues, and then you can see a net income. So for the financial variables, this article that I'm recommending is an article that outlined formulas for calculating financial indicators. So if you're someone that would like to calculate a financial indicator but has no clue what that would mean or how to calculate it, like me, then this Flex monitoring team, they specialize in critical access hospitals, and they look at critical access hospitals and their financial health. But they've come up in this briefing paper some financial indicators that they thought were relevant and important for financial health. And they come up with the actual locations within the worksheet. So they give you, for calculating margin, you would look at this particular worksheet, this variable, and they get pretty detailed. And I thought it was really a nice resource for people if you wanted some guidance on financial indicators. And again, this is the document that we were speaking of just a moment ago, Sources of Financial Data on Medicare Providers from MedPAC, and it's in June of 2004. That's excellent, excellent reading. And finally, another research topic and the focus of our 2 days, calculating costs. So using cost-to-charge ratios to adjust facility charges to cost. And we can get it at a total hospital, all-payer cost-to-charge ratio. We can come up with departmental or cost center level, all-payer cost-to-charge ratios, or we can come up with Medicare cost-to-charge ratios that are Medicare specific. And we can use it in economic evaluations. So more to come on the cost-to-charge ratios in the next segment. The costs and charges for the entire hospital, all payer, is found on worksheet C. If you're looking for Medicare-specific costs, that's on worksheet D. This is an example of what worksheet C looks like. So here we have all the costs, total costs, and you'll see how it breaks out. And then all charges, inpatient and outpatient charges. Okay, other resources for calculating cost. Survey information. So you could take a look at the Medicare Current Beneficiary Survey. I kind of wish Yvonne was here to speak on this one, but I know that CMS used the MCBS when they were looking at the Part D. Before Part D came about, they would use the MCBS as a way to gauge the prescription drug costs. So survey information may contain cost. Well, we had talked about medical expenditure panel survey, MEPS, and HCUP, and we looked, and the costs that are being calculated, it's coming from the cost reports. And then the last, I'm throwing this out here as an option, not that I'm suggesting to you that you would actually do this, but you can, if you're working with one hospital, you could ask for their accounting, their cost accounting information to get at what the provider's cost is. So, unless you're doing a case study, I don't know that that last one is really an option at all, but we'll just keep them out there. So, in summary, the main types of research that's using cost reports are looking at facility characteristics, financial health, and calculating cost or cost-to-charge ratios.